Honey, I'm home.
I cured all my patients, so I came home to spend time with Rachel.
I got 100% on my spelling test.
None of this is possible.
Got your scans back from today.
Imaging shows enhancing masses across multiple lobes of Cuddy's lungs. She's dead.
What? No, that cannot be right. That means the mass in her kidney is cancer. Oh, so cruel to show all those imagination pictures of their future together. If she dies, then all her dreams go with her. Very excited to be reacting to House MD Season 7, Episode 15, Bombshells. On this channel, we are reacting to all 177 House videos, and this will be episode 147. Let's see if I can get the diagnosis before House does as a doctor working in London.
The house? It's like dating a 10-year-old. I have to pee. House, shut up. There's blood in my urine.
16-year-old male spit up blood during a pickup basketball game. ER couldn't find the source in his lungs or GI tract.
Your records show you've lost some weight over the past year. Was that intentional?
Not really.
How long have you been cutting yourself?
Those are from a layback grind that went wrong.
How long have you been depressed? The kid did admit to being depressed and to smoking pot to take the edge off.
Run a lead level, push 5 liters IV fluid. Your hypochondriac mom had a brush with mortality last month, and it's understandable that you're worrying more than usual.
Odds are this is nothing. I need to schedule an ultrasound.
And you also know what it's like to be depressed. Well, you figured out my deal after only a few minutes.
I ended up hurting myself. Stupidest thing I've ever done. You've got red spots in your eyes.
You have nice skin.
Thank you. Shut up.
Ultrasound isn't definitive. We should run other tests. There's a mass in your kidney.
Infection makes the most sense. He shoots hoops at school, showers in the locker room.
I'm a single mom. I need to set up a trust, appoint a guardian. It's silly that I haven't done it before now.
I want my stuffed ass hat. I told you, man, I don't have it here.
How often do you sell drugs?
It was a one-time thing.
Give the thug his money back.
It's not even a question. Of course I'll be Rachel's guardian.
Oh, how will House feel about Cuddy making single mom plans when they're supposed to be a team? Maybe a wake-up call that this team needs itself a bit of super glue in the form of a marriage contract. If the worst thing did happen though and House had to be a lone parent, then what happens if a teenager rebels against a rebellious parent? She's either gonna turn into Mother Teresa or a mob kingpin. The patient needed more than a therapist to get out of his situation though, as it seems he's been spiraling out of control without his parents even knowing about it. He's 16, lost interest in his usual activities, and when he talks to his parents about not feeling so good, they feel guilty, then he has to cheer them up. Definitely not the way that dynamic is supposed to be going. He might not have much more time to be depressed though if we don't figure out why he's spitting up blood, so what could that be? We know he's smoking cannabis, has lost weight over the last year, and has red spots around his eyes. Differential, well, metabolic could be diabetic ketoacidosis, although that isn't very rare. Wilson's disease could potentially do it as well. Infectious could be TB, or actually leptospirosis, potentially from rodents. If he's a drug dealer, then he might be spending some time around them next to his stash. Degenerative could be alpha-1 antitrypsin deficiency. Neoplastic could be leukemia or lymphoma. Inflammatory, potentially granulomatosis with polyangiitis. That would fit really well and explains the red spots on the eyes as well. For toxic, the team did rule out lead poisoning, but he could have still poisoned himself with rodenticide. Maybe he was so depressed that he did it on purpose. It's possible. Interesting though that Taub admitted that he wasn't handling pressure well at med school and ended up cutting himself. Him as a character is really growing on me, as at the start I thought he was just arrogant and pretentious, but my perception has totally changed. Alright, I'm going for leptospirosis due to rodent exposure as my first diagnostic guess. Let's get more clues.
Rachel Cuddy, you were supposed to be home half an hour ago.
She was shoplifting down at the mall. Are either of you this girl's father?
Nope! But since her mom died, she's my favorite tax write-off.
I think I just peed blood.
Peeing blood is the new black.
Antiphospholipid syndrome.
Start the patient on plasmapheresis. She needs support and comfort, both things that I famously suck at. There's no proof that there's anything wrong with her.
There's no proof she's being stalked by ninja squirrels either, but if she's scared of them...
You're right.
All these years, he's never stopped trying to annoy me for more than 15 minutes. Now he can't even walk into the room.
I don't think fixing this kid is gonna fix you. A patient lost all feeling in his right arm.
Chase?
Help me!
I'm coming. Looks like we got company.
Are you okay?
Clots could explain everything, including the numbness. We should do an angiogram of his brain, see if we can find it.
Do an angiogram. You two go to pathology and look at Cuddy's slides.
Did I just foreshadow Cuddy Jr.'s altercation with the law? Universal, give me a team, I'll do the writing, and it'll have the wackiest plot lines with long-lost aunts needing to be discovered with a secret pin in the shoebox that was covered with ricin laced with Amazonian jungle toad poison. I mean, I should probably finish watching this series first though, so that I know how it ends. This patient might meet her own end soon though if we don't figure this out, as we have some juicy new clues. He's lost sensation completely in his right arm on the back of also peeing blood, spitting up blood, and having bloodshot eyes. I wonder if he might have a problem with bleeding. See, blood is in a constant equilibrium between bleeding and clotting. The team now thinks he has clots though, even though his blood vessels have turned into the body's version of WikiLeaks. I don't buy it, but another bleed in the brain that triggered his sudden arm numbness is on the cards though. So what could cause multiple microhemorrhages like this and still not cause a single trace? Maybe his clotting function is swinging based on some kind of external trigger, like we know that he's depressed. Is he taking antidepressants secretly? SSRIs can actually cause bleeding, but it's just not really a spicy diagnosis. Also, judging from his art skills, it doesn't seem like he's very well medicated at all. There are some interesting points about treatments he's already tried as well, like he's had steroids and antibiotics, both of which have been ineffective. That kind of rules out autoimmune and infectious, which means that blood does increase in likelihood. Oh, okay, I have a theory. Maybe the depression is actually caused from a microinfarct in his brain before all of this, and he has actually got the mix of clots and bleeding, but not from DIC, from TTP. It's called thrombotic thrombocytopaenic purpura, and it's a genetic condition that can be triggered by lots of different medications or hormone treatments. We know he's in the drug sphere. Maybe he took testosterone to try and put the spring back in his step, which ended up bouncing him into hospital. That would actually work really well. All right, I'm going for thrombotic thrombocytopaenic purpura as my second diagnostic guess. Also, clearly the budgets were being cranked right up at this point though. Did you see that zombie clip? Turn that into a game and I will play it. All right, let's get more clues.
I violently executed my 10th grade geometry teacher about 5 different ways in my mind.
Ever think about what you might do to House? The mass is near the center of her kidney. They couldn't get a readable sample.
Angio showed a clot in a branch of his middle cerebral artery. Started him on streptokinase to break it up. Look, however bad you think you're gonna be in that room, not being in the room is worse.
Honey, I'm home.
I cured all my patients, so I came home to spend time with Rachel.
I got 100% on my spelling test.
None of this is possible.
Got your scans back from today.
Imaging shows enhancing masses across multiple lobes of Cuddy's lungs. She's dead.
What? No, that cannot be right. That means the mass in her kidney is cancer. Oh, so cruel to show all those imagination pictures of their future together. If she dies, then all her dreams go with her. The series was getting a bit slow with no real major revelations recently, but this is a wild card that I did not expect. Kidney cancer that has metastasized to the lungs. How bad is it? Well, it automatically puts her in stage 4, for which a 5-year survival rate, even with treatment, can vary massively depending on the tumor, but realistically would be less than 50%. Best case scenario is a coin flip. Worst case scenario is pretty much a reverse Russian roulette with 5 barrels loaded, just under 20%. In some cases, they can cut out the lesions in the lung, but that still is delaying the inevitable with a 5-year survival at 60%. Madness. I need to see what happens here.
We invented seatbelts in grocery stores. Things that keep idiots and weaklings alive. Most of you don't really deserve it. Yes!
It goes on. He talks about bombing his school.
Ryan's not responding to streptokinase.
We'd like to do an embolectomy. We'll run a corkscrew-shaped instrument into Ryan's brain and pull the clot out.
There's the clot. It just disintegrated when you touched it.
I was hoping you'd figure out a way to handle all this.
I should have been here.
I knew you'd come.
Why is his liver shutting down? I think his brain goes away, the kid slips into a coma.
And he'll be dead in a day.
If you don't make it, I won't sleep with anyone for at least a month.
Make it 2.
Forget your troubles, come on, get happy. The Lord is waiting to take your hand. Forget your troubles, come on, get happy.
Hi.
Your tumor was benign. We got it out. You'd be fine. It's the lung masses were an allergic reaction. Say hello to your tumor.
There are so many things that I could be afraid of. All those doors just burst open. You just figured something out about your patient, didn't you?
Oh, it's benign! What a relief. I'm very much enjoying this happily ever after between House and Cuddy, and all the producers just love toying with us by threatening to make it go away. Cheeky, yet so engaging. What's even more engaging though is we have an epiphany moment. It's all about doors bursting open. The team also mentioned that the clot disintegrated when they touched it in the patient's brain. Is that the door opening? How did that then lead to sudden onset liver failure? Maybe the clot itself was protecting the patient somehow and the new blood flow made it worse. Where else in the body could a clot actually be protecting? Well, if he had multiple aneurysms that the body clotted off, then thinning the clots could cause them to burst. We know that they gave him the clot-busting drug, streptokinase, when they thought he had a stroke, which would be a very bad idea in that case, since the bleeding would then be uncontrollable if he was prone to it. Okay, I have a theory. If he had inflammation in those blood vessels that was triggering this, then that could be leading to those aneurysms without them even necessarily being visible on a scan. Initial blood tests could be negative as well, unless they were specifically looking for it. So what is it? Find out after the break. Just kidding. It's microscopic polyangiitis. Treatment would be with immunosuppressant medications like steroids, but usually they need an additional drug with it like cyclophosphamide or rituximab as well. That could work here for sure, but I don't know how the kid's explosive tendencies have to do with it. But it seems like natural selection would have ironically selected him out as well if it wasn't for all of his societal comforts like healthcare. All right, I'm going for microscopic polyangiitis as my third and final diagnostic guess. We are locked in.
He's got a staph infection, but once the door's been busted open, more just keep coming.
What if these aren't from skateboarding? Once we drain the abscess and remove the shrapnel, the antibiotics can do their job.
You took Vicodin when you came to my hospital room that night.
How did you know?
My subconscious was trying to tell me you could never get through this without drugs.
I could do better.
I don't think you can. I thought I could do this.
Don't.
Goodbye, House.
What? This plot had more twists and turns than floppy spaghetti in a centrifuge. House took the Vicodin because he couldn't bear the thought of opening himself up to Cuddy because of the pain it might cause. He then numbs himself using the pills to let him cope in a situation he wouldn't be emotionally available enough to face otherwise. For Cuddy, that's the end of the line. My diagnostic skills reached their limit here too because staph infection due to shrapnel presenting as spitting up blood. Yeah, I was not getting that. Great episode though, loving the plot progression, although I hate what actually happened. Will be quite interesting and heartbreaking to see House's spiral after this. 8.4 out of 10 entertainment, 5 out of 10 diagnosis because shrapnel, and 6 out of 10 accuracy because staph infection wouldn't present with bleeding really, and the area around the shrapnel would have signs of infection as well as clear markers on the blood. Not a House diagnosis really. This episode doesn't make sense until you watch a previous one where a crime scene cleaner has a different face for his wife.